Hello everyone. Welcome back to our channel. Are you aware that some everyday medications might be increasing your risk of dementia? Have you ever questioned if the pills you take regularly could be affecting your cognitive health? In today's video uncovers eye-opening details about 10 widely used medications that recent studies have linked to the development of dementia. Discover which medications are involved, understand the potential risks, and learn about safer alternatives for managing conditions like anxiety, insomnia, depression, and chronic pain. This insightful video might just change your perspective on medication and the steps you take to safeguard your mental health. Stay tuned until the end because the 9th medication on our list is particularly concerning. Many people are unaware of its risks. Let's get started. Medication 1: Beta blockers. Beta blockers, such as propranolol and metoprolol, are commonly used medications for treating conditions like hypertension, heart rhythm disorders, and anxiety. These drugs work by blocking the effects of adrenaline, thereby slowing down the heart rate and reducing blood pressure. Although effective in managing these symptoms, some studies have indicated that long-term use of beta blockers may be associated with cognitive decline. Specifically, a study conducted at the University of Washington followed over 3,500 individuals for more than 7 years and found that those who used beta blockers long-term had a higher risk of cognitive issues compared to those who did not. This research suggested that individuals using beta blockers had a 20 to 30% increased risk of experiencing cognitive impairment and memory-related problems. Additionally, another study published in the British Medical Journal, BMJ, analyzed data from over 2,000 elderly patients and found that those on beta blockers had a higher incidence of dementia compared to a control group. The researchers believe that the reduced blood flow to the brain, caused by beta blockers, may be a key factor contributing to this increased risk. These studies underscore the importance of careful monitoring when using beta blockers, especially in elderly individuals or those with pre-existing cognitive risk factors. If you or a loved one is taking beta blockers, it is crucial to discuss with your doctor about potential alternative treatments that might pose less risk, such as lifestyle changes or other medications with less impact on cognitive function. Your doctor may suggest alternative strategies or adjust the current medication dosage to minimize the risk of cognitive decline while ensuring effective treatment of the current medical conditions. Medication 2: Antihistamines. Second-generation antihistamines, such as cetirizine, Zyrtec, and loratadine, Claritin, are commonly used to treat symptoms of allergies, including runny nose, itchy eyes, and rashes. These medications work by blocking the action of histamine, a chemical in the body that causes allergic symptoms. While generally considered safe and less likely to cause drowsiness than earlier generations, there are concerns about the long-term effects of these medications on cognitive health, especially in older adults. Studies have shown that antihistamines can impair attention and reaction times, which may lead to long-term cognitive issues. A study conducted by Indiana University analyzed data from over 3,000 adults and found that those using second-generation antihistamines had a higher risk of cognitive issues, including memory decline and slower processing speed. The study indicated that prolonged use of these drugs could have more severe effects on cognition compared to non-users. Additionally, another study published in JAMA Internal Medicine explored the link between antihistamine use and the risk of developing dementia. This research suggested that long-term use of antihistamines was associated with an increased risk of dementia, particularly in older adults. Researchers believe this effect may be due to antihistamines reducing the activity of acetylcholine, a neurotransmitter crucial for cognitive functions. The decline in acetylcholine activity can lead to issues with memory and learning. Don't forget to subscribe to our channel to update the latest health information. Medication 3: Muscle relaxants. Medications like cyclobenzaprine and carisoprodol are often prescribed for muscle spasms and pain. These drugs work by relaxing the muscles, helping to alleviate pain and improve muscle function. However, long-term use of muscle relaxants can have significant side effects on cognitive health. Muscle relaxants often have sedative effects, which can cause drowsiness and decreased reaction time. This can lead to memory problems and confusion, especially with prolonged use. These medications can affect the function of neurotransmitters in the brain, such as gamma-aminobutyric acid, GABA, impairing the communication between nerve cells. A study published in the journal Age and Aging explored the relationship between muscle relaxant use and cognitive decline in older adults. This study followed over 2,000 elderly individuals for 5 years and found that those who regularly used muscle relaxants had a higher risk of experiencing memory and cognitive issues compared to non-users. Additionally, another study conducted at Stanford University analyzed data from over 1,500 patients and found that long-term use of cyclobenzaprine was associated with a decline in memory and learning abilities. Researchers suggested that the sedative effects of the drug might reduce brain activity, leading to cognitive impairment. Non-drug approaches such as physical therapy, exercise, or other pain relief methods can also be considered. While muscle relaxants can be effective in reducing pain and muscle spasms, their long-term use needs to be carefully monitored to ensure they do not harm cognitive health. Medication for antidepressants, SSNRIs. Serotonin norepinephrine reuptake inhibitors, SSNRIs, such as venlafaxine, Effexor, and duloxetine, Cymbalta, are commonly used medications for treating depression and anxiety. These drugs work by increasing the levels of serotonin and norepinephrine in the brain, two neurotransmitters that are crucial in regulating mood and emotions. Although effective in reducing symptoms of depression and anxiety, there are concerns that long-term use of SSNRIs may be associated with an increased risk of cognitive decline. The exact mechanism of this decline is unclear, but it may involve changes in brain chemistry over time. Some studies suggest that altering levels of serotonin and norepinephrine may affect cognitive functions, including memory and concentration. A study published in the journal Psychological Medicine analyzed data from over 6,000 individuals and found that those who used SSNRIs long-term had a higher risk of memory problems and concentration issues compared to non-users. This study emphasized that the risk of cognitive decline could be particularly pronounced in older adults or those already at risk for cognitive issues. Additionally, another study in the Journal of Clinical Psychiatry indicated that long-term use of venlafaxine might be linked to declines in memory and problem-solving abilities. Researchers suggested that this effect could be due to changes in the brain's chemical balance, affecting the communication between neurons. Medication 5. Corticosteroids. Corticosteroids, such as prednisone and dexamethasone, are commonly used medications to treat inflammatory conditions. They work by suppressing the immune system and reducing inflammation, helping to control symptoms of various diseases, including arthritis, asthma, lupus, and inflammatory bowel disease. While corticosteroids are very effective in controlling inflammation, prolonged use can lead to significant side effects, including potential impacts on cognitive health. These side effects can include mood swings, memory problems, and in some cases, steroid-induced dementia. Corticosteroids can affect hormone balance in the body, leading to changes in brain chemistry and resulting in cognitive decline. A study published in the journal Neurology examined the link between corticosteroid use and the risk of developing dementia. The study indicated that long-term use of corticosteroids might increase the risk of developing dementia, particularly in older adults. Researchers suggested that this increase might be related to the impact of corticosteroids on neuronal cells and their reduced ability to self-repair. To mitigate these risks, it is important for patients and healthcare providers to regularly evaluate the necessity of corticosteroid therapy, particularly for long-term use. Alternative treatments or the lowest effective dose should be considered to minimize potential side effects. Regular cognitive assessments may also be beneficial for those on long-term corticosteroid therapy to detect any early signs of cognitive decline. Medication 6. Anti-hypertensives, ACE inhibitors. Angiotensin-converting enzyme, ACE, inhibitors, such as lisinopril and enalapril, are commonly prescribed to treat high blood pressure. These medications work by blocking the angiotensin-converting enzyme, which relaxes blood vessels and reduces blood pressure, thereby improving blood flow and reducing the workload on the heart. While ACE inhibitors are highly effective in controlling blood pressure, some research suggests that long-term use may be associated with cognitive impairment, particularly in older adults. The exact mechanism of this impairment is not fully understood, but it may involve changes in the renin-angiotensin system, affecting blood flow to the brain and overall brain function. A study published in the journal Hypertension analyzed data from over 5,000 elderly individuals and found that those using ACE inhibitors long-term had a higher risk of memory problems and concentration issues. This study indicated that users of these medications had a 20 to 30% increased risk of cognitive decline compared to non-users. Researchers believe that changes in blood flow to the brain and impacts on neurotransmitter levels could be significant factors. For individuals taking ACE inhibitors, it's essential to remain informed about potential cognitive risks. Regular consultations with healthcare providers are crucial to discuss any observed changes in memory or cognitive function. It may be beneficial to explore alternative medications or adjustments in dosage with your doctor, particularly if you are experiencing cognitive symptoms. Additionally, incorporating lifestyle changes, such as a balanced diet, regular exercise, and mental stimulation. It helps support overall brain health and potentially mitigate some of the risks associated with long-term medication use. Medication 7. Calcium channel blockers. Calcium channel blockers, such as amlodipine and verapamil, are commonly used to treat high blood pressure and certain heart conditions. They work by inhibiting the influx of calcium ions into smooth muscle and heart muscle cells, which helps to dilate blood vessels, reduce blood pressure, and decrease the force of heart contractions. The use of calcium channel blockers can lead to excessive lowering of blood pressure, causing dizziness, headaches, or fainting, especially when standing up quickly from a sitting or lying position. Some studies suggest that calcium channel blockers may increase the risk of heart failure, particularly in patients with pre-existing risk factors or underlying cardiovascular diseases. A common side effect of calcium channel blockers is edema, especially in the legs and ankles, due to the dilation of blood vessels. These medications can also cause constipation, particularly with types like verapamil. Some studies have indicated a potential link between long-term use of calcium channel blockers and cognitive decline. The mechanism may involve reduced cerebral blood flow due to the vasodilatory effects of the drug, leading to decreased oxygen and nutrient supply to the brain. Medication 8. Sedative hypnotics. Sedative hypnotic medications, such as zolpidem, Ambien, and esapicolone, Lunesta, are commonly used to treat insomnia. They work by slowing down the activity of the central nervous system, helping users to fall asleep more easily. Users may experience temporary amnesia, anterograde amnesia, where they are unable to remember events that occur after taking the medication. Research has shown that long-term use of these sedative hypnotic drugs may be associated with an increased risk of developing dementia. A study published in the BMJ found a link between the use of sleep medications and a higher risk of dementia, particularly in older adults. Many users report feeling drowsy or groggy in the morning after using these medications. This can affect their ability to safely perform daily activities, such as driving or operating machinery. Sedative hypnotics carry a high risk of dependence, especially when used for extended periods or not as prescribed. Abrupt discontinuation can also lead to withdrawal symptoms such as anxiety, insomnia, and tremors. Other side effects may include headaches, dizziness, and digestive disturbances. Some people may also experience unusual behaviors while asleep, such as sleepwalking, sleep talking, or even sleep driving. Medication 9. Antiemetics. Antiemetics, such as metoclopramide and prochlorperazine, are commonly used medications for treating nausea and vomiting. These symptoms can arise from various causes, including gastrointestinal disorders, chemotherapy, and migraines. Antiemetics work by blocking dopamine receptors in the brain's chemoreceptor trigger zone, which helps reduce nausea and prevent vomiting. Blocking dopamine receptors can lead to changes in brain function, contributing to memory problems and cognitive decline. These are drug-induced movement disorders that can include symptoms such as tremors, rigidity, bradykinesia, slowness of movement, and dystonia, involuntary muscle contractions. EPS is particularly associated with drugs that block dopamine, such as metoclopramide and prochlorperazine. A serious and often irreversible condition characterized by repetitive, involuntary movements, particularly of the face, lips, and tongue. These medications can cause significant drowsiness and sedation, which may impair the ability to perform tasks requiring alertness, such as driving or operating machinery. In some cases, antiemetics may cause mood changes, including depression and irritability, due to their effects on neurotransmitter balance in the brain. Metoclopramide, in particular, can increase prolactin levels, potentially leading to galactorrhea, unexpected milk production, and gynecomastia, breast enlargement in men. Patients experiencing any unusual symptoms, such as movement disorders or cognitive changes, should consult their healthcare provider promptly. In many cases, the use of these medications should be limited to short-term scenarios, and alternative treatments should be considered for long-term management of nausea and vomiting. Medication 10. Benzodiazepines. Benzodiazepines, such as diazepam and lorazepam, are widely used to treat anxiety, insomnia, and other stress-related disorders. These medications work on the central nervous system, providing a calming effect by enhancing the action of the neurotransmitter gamma-aminobutyric acid, GABA. While effective in relieving acute symptoms, prolonged use of benzodiazepines can pose serious risks to cognitive health. Recent studies indicate that continuous use of benzodiazepines is associated with a significant increase in the risk of developing dementia. The physical and psychological dependence that can arise from prolonged use of these substances further complicates the situation. For instance, a study conducted in France followed more than 1,000 elderly individuals over 15 years and found that those who regularly used benzodiazepines had a 60% higher risk of developing dementia compared to non-users. These alarming data underscore the need for a critical review of the use of such medications, especially among the elderly, who are more vulnerable to adverse effects. There are therapeutic alternatives, such as cognitive behavioral therapy, which can be equally effective in treating anxiety and insomnia without the same risks associated with dementia. Transitioning to these alternatives should be carefully planned and monitored to avoid withdrawal symptoms and ensure treatment efficacy. We hope you found the information helpful and that it encourages you to take a closer look at the medications you or your loved ones may be taking. Understanding the potential risks associated with these drugs is crucial for making informed decisions about your health. Remember, your health decisions are important, and staying informed can make a big difference in your overall well-being. If you have any concerns about your medication, don't hesitate to consult your healthcare provider. They can provide personalized advice and suggest safer alternatives that suit your specific needs. Don't forget to like, share, and subscribe to our channel for more videos on health and wellness. Thank you for watching, and we look forward to seeing you in the next video.